Okay, so when we were watching that video, I noticed something that really stuck out on the screen. And it's costing us $26 million a year, or is that $26 billion a year?
So it's over $26 billion a year now. Those were 2005 numbers that came out of an Institute of Medicine study showing just the impact of preterm birth and premature infants in the United States alone. And those were short-term healthcare costs, not the long-term costs of all the side effects that premature babies will have throughout life. And even if you look at this state, so there are over 500,000 premature babies in the United States every year. There are about 8,000 babies in the state of Washington alone born prematurely. And it is costing the state of Washington over $400 million a year to take care of these children in the short term. And it has a huge economic impact on productivity of the parents, on jobs, and on business productivity. So the impact that we are looking at from the GAPS perspective is truly global. This is truly a global problem. It's not about just the developing world. Certainly the numbers are huge, 13 million preterm births and over 3 million stillbirths every year. It's affecting our own communities in our own backyards, rich or poor, independent of socioeconomic status. This affects everyone, everywhere.
So I'm going to try and get my arms around this one because these are some pretty big numbers. We already have some problems just in our own state in regards to budget deficits. We've got huge impacts on our healthcare systems. And some of this is preventable. Some of this impact is preventable. And we're talking about not only the economics, but we're also talking about the emotional impact that the parents of a premature or stillborn child. So what can we do? What kinds of preventative things can we do within our own community and, of course, in regards to the world?
So in our own community, there are a few things that we can do to prevent preterm birth. And we are already doing things in the United States to have a fairly low rate of stillbirth, although it's still 25,000 stillbirths a year, which is 10 times more than sudden infant death syndrome. One of the things that came out of our report was how little we knew about how to prevent preterm birth. And in fact, even if all the women in the United States quit smoking, even if we did things to try and improve prenatal care, it would only impact the preterm birth rate by 4%. And when we looked at why we don't do a better job of preventing, it's because we don't understand the biology and some of the basic principles behind normal, healthy pregnancy that could help us understand why some women have preterm birth and other bad outcomes of pregnancy. So it's really that lack of knowledge that we're focusing on, because out of understanding and knowledge comes opportunity to prevent those things. In the United States and even in Washington State, we do a great job of taking care of these kids. It's one of the best things we do at Seattle Children's. And we have a large population. And it was out of that recognition that we need to do something to actually eliminate this, not just treat it, and not just care for these infants. That GAPS actually, that was the spawning moment for GAPS, if you will. And along with Tom Hansen, our CEO, he helped co-found this and get this started. So it's very visionary, in my view, and it gives us a chance to really focus on what's needed to start developing new preventive strategies to either prevent preterm birth or prevent stillborn infants, even in this country.
Thank you, Craig. We'll take a quick break now. Hi, this is Gail Romero, and we're back with Dr. Craig Rubens from Children's Hospital in Seattle, Washington, and the GAPS program. So, Craig, one of the things that really intrigues me is we've got some really wonderful opportunities for prevention. And the GAPS program has several different opportunities in and of itself. What are your first initiatives that you're working on? And I think the repository is one that I'd really like to touch on at this time if you've got some thoughts on that. you'd like to
So let
share?
me step back just a moment to help you kind of understand, because these issues are so big, they impact the world, they impact our local community. And there are some real holes in our understanding which are preventing us from moving forward and what we really need to focus on. So the Global Alliance to Prevent Prematurity is aligning key stakeholders, scientists, policymakers, and those that help sort of develop a research environment so we can really study what's going on. So there are three main pillars to GAPS. The first one is research and development, really trying to get at studies that will help us understand healthy pregnancy, why women get infections that lead to preterm birth, or why they get infections or have other problems that lead to stillborn infants. The second one is developing the research infrastructure that will support scientists even in this country, but also in the developing world, so they can study their populations and understand why those women are at risk. Because we are beginning to understand that women in different environments and different settings actually have different risks for preterm birth or stillbirth. And the third thing that we're doing is advocacy, raising the visibility of the problems, trying to get more scientists engaged, get policymakers who fund research and development engaged, and also to reach out to the partners like we're doing with PATH and the Department of Global Health at the University of Washington and other key players around the United States and around the world to get involved in this and work together with us in a collaborative effort to make a difference.
Okay, so you've got a really well thought out business plan. Obviously, Children's Hospital and your leadership, your team, have put together a really great plan. What are some of the steps that you see happening within the next year or two that is actually going to bring this to the forefront of people's consciousness and really get this ball rolling?
So one of the things that we've been engaged in doing ever since we put out our report a year ago is really helping people understand all the various facets of what needs to be done. One of the first things that was done was that in May of 2009, we had a conference here of all the world's experts, or many of the world's experts, on maternal and newborn health. And they came up with a global action agenda. It was a real working conference. We had very few people just talking. We had a lot of people working in groups and coming up with what is an action agenda. And that got published with that big report. So we have kind of a roadmap of what we think needs to be done along the lines of the science, getting interventions that we think would work out into the community, whether here or abroad, and then the kinds of things that need to be done to demonstrate that we really are having an impact. If it isn't working, let's go back and fix it and figure out a way to make it work. So that's one thing, the big global action agenda that we put out. The second is to work on this research systems and infrastructure idea, building biobanks that collect data and specimens on pregnant women and babies that scientists and other researchers can use to help them understand what is it that's contributing to the rates of preterm birth and stillbirth around the world. It's becoming very important to do the research in the country where it's happening so that you can really understand the population and the different things that they're exposed to, environmental exposures, infections, stresses, other things that we now think are associated with preterm birth.
So is that repository then here in Seattle?
So we have a biobank and what we call a repository that is collecting data and specimens on pregnant women. We have one going, and there are 2 other sites in Washington State, and then the hope is in the next year to bring on 2 more. And they will serve as a great resource for scientists, research and development, to look at a variety of different questions that hopefully will lead, this is our big push, hopefully will get the science and the information and knowledge we need to actually start creating preventative interventions, preventative ways of keeping getting the rates of preterm birth and stillbirth down. Right now we can treat, but we still have premature infants. We want to prevent. We want to stop this from happening.
And that's where the cost savings comes in.
That's correct.
That's the economic impact. So that's why it's a good investment to support what you're doing, because we can save money long term.
That's correct.
Okay.
The idea is that right now, the costs that we talked about earlier on in the show really are the costs that is impacting society now. It's number 7 in public health care costs, preterm birth. And yet, if you look at the investment in research and development of ways to prevent these diseases from happening, it's like down in the 100 range.